Welcome to the Everything Cancer podcast. This podcast is intended for survivors, those who love them, healthcare providers, and leaders of cancer support organizations. Our guests offer insight into the honest survivor experience, how challenges are met head-on, and where blessings are discovered. We cover effective self-advocacy on the bumpy road of cancer survivorship from the moment of diagnosis on. We talk about rekindling intimacy when cancer has changed your world. We are given behind the scenes insight into cancer care because understanding it better empowers you to advocate for yourself more effectively. We hear from leaders of cancer support organizations about their resources and how to access them or those like them. The Everything Cancer podcast welcomes survivors who would like to share their journey and how they have met their challenges, providers who would like to share their empowering insight, and leaders of cancer support organizations who would like to share their stories and resources. We welcome support through sponsors, the Everything Cancer website, and our Patreon page. Please note, the information shared on the Everything Cancer podcast is not intended as medical advice. Please always consult with your healthcare team. The staff at Everything Cancer podcast will not answer individual healthcare concern questions. Thank you for joining us, and we hope that you enjoy this episode and find it useful. Please do share it with other people if you think they'll benefit from it, and rate us on your favorite podcast platform. Thanks and take care. Hello, everybody. Welcome to Everything Cancer. We are privileged to have Stephanie Gayhart with us. I'm going to let her tell you her story. She does have a master's in health innovation, which probably gives her a really enlightened perspective on a lot of what she has experienced. Stephanie, go ahead and take it away.
Hey, thank you so much for having me. This is great. I have a master's in healthcare innovation, which I got after working at the bedside in nursing for, 10 years before I did that. And actually, I got my master's after my cancer diagnosis and treatment. So
Wow.
it spurred a lot of change in my life.
I'm sure. So, if you don't mind walking us through what happened with your diagnosis and then after.
Yeah. So I was working probably my 8th year as a critical care nurse at the bedside. Um, Noticed a lump in my neck area. Thought I was overreacting. Asked one of the intensivists I work with, like, "Hey, can you check this thing out?" And he was like, "Yeah, you should probably look into it." And I was like, "Okay." And then whatever, continued about my day. A couple days later, noticed it started to hurt when I was talking and when I would swallow. And I was like, that's weird. Why are they related? And I wound up looking in my mouth and noticing this lump on my tongue, on the left lateral posterior border of my tongue. And I was like, oh, ugh, that's weird. I was like, well, I'll go to the dentist. That's, they'll tell me what's up. It's probably some kind of weird infection or whatever. So I went, they gave me some steroid cream. I was 37 years old at the time, by the way. So not a smoker, not a heavy drinker, anything like that. No family history. And they also looked like, and they were like, well, here's some steroid cream, here's some antibiotics, we'll see you back in a week. Went back in a week, nothing had gotten better. In fact, it was getting worse. And they were like, yeah, I don't know. And I do remember she brought a second dentist in, and he was like, well, did you tell her what it probably isn't? And she said, no. And I was like, and he said, yeah, it's probably not cancer. You're too young. But you need to go to an ENT because it's too far back for us to do anything. Cool. Went to the ENT. He, again, was like, you're too young. There's really no possible way that it's anything to worry about. Here's some more steroids. Come back in 2 weeks. And at that point, I was like, this has been about a month or so since I noticed it, and rapidly getting worse. So I think I went home and took maybe 2 days of the steroids, realized that they were not going to do anything, and stopped taking them because they were making things worse. Then I was also very angry. And I waited out the 2 weeks. I was taking 800 milligrams of ibuprofen 3 or 4 times a day at that point. And when I went back, I was just fired up. And I said, look, if you don't do a scan, I'm going to kill my kidneys with the ibuprofen. So I really would appreciate if we could just figure out what this is and get rid of it. So that's when I finally got the CT scan order. And I was back at work. And I remember getting a phone call and going back into the break room, and it was the ENT. And he was like, well, first of all, knowing that the doctor himself called me was a red flag. But
Mm-hmm.
he was like, there's a mass, but I still don't think it's cancer. But because of its location, I'm going to send you downtown to this guy. Um, I'll call ahead. They'll try to get you in. Um, Initially, it was going to be a couple months, but they pulled some strings and got me in the next week. Thank goodness. Um, when I walked into his office, Dr. Kyle Hatton, he is a phenomenal ENT surgeon at the University of Maryland. And he just said, you know, he sat in front of me, which was so important to me on eye level. And he said, I'm going to tell you right now, before I even take the biopsy, I'm pretty sure you have cancer.
Mm.
And up until that point, all I had heard was basically, you're crazy. This can't be cancer. You're too young. You're too healthy. And here this guy was like, you probably have cancer. I was like, I'm sorry. What does probably mean? And he was like, more than 50% sure. So he did the biopsy. I went into action. We made a plan for surgery. He told me I'd probably have to lose part of up to half of my tongue.
Oh, wow.
Um,
That'd be devastating to hear.
yeah, at the time, I don't think I really thought about it.
Yeah.
My medical mind was like, am I going to need a tracheostomy? It's going to be a lot of swelling. Am I going to have a feeding tube? It's going to like all
Mm-hmm.
of that stuff's going through my head. And at the same time, I'm like, oh my God, what am I going to tell? I had a 6-year-old at home. What am I going to tell him? Like, what does this mean for my career? How long am I going to have to take off work? Um, and he said too, like, if I'm wrong, if it's not cancer, we'll high five and we'll come up with a new plan. And I was like, okay, I like that. That's cool. Within 48 hours, he had called me back and it was squamous cell carcinoma. Um, so we went ahead with everything. Again, I was at work when that phone call came in. Um, and somehow my amazing team had figured out a way for me to be able to go home. I was in charge that day, and my manager must have called the shift coordinator, and they sent me home, and I went and comforted my parents. They were a mess, and I was just
Mm-hmm.
like, it's okay. Because I think when you're diagnosed, you just go into this, it's like it's another dimension, and you feel like you have to be the strong one
Uh-huh.
because everybody else is so upset.
Mm-hmm.
And I mean, I had my moments where I broke down in between and thinking about all these things and meeting with the different surgeons. I had two surgeons, one for the hemiglossectomy and one that rebuilt the part of my tongue they took away. And you know, I think the whole time my biggest concern was that I had to have a tracheostomy, and I was like, I don't understand how people breathe through their necks. Like I've taken care of it, but is it going to feel weird? Am I gonna like that was literally my biggest concern.
Right.
Um, and then yeah, I mean, my work I took off those 3 weeks in between and had my billions of appointments and checkups and blood work and everything, and spent time with my family and my friends, and then had the big day.
That had to be really tough to go into the OR that day.
It was, I don't think I slept the
Yeah.
night before. Um, I remember walking in, it's kind of surreal being a nurse, knowing what those nurses are doing, knowing, okay, it's 6:30 in the morning. They just got here. They're preparing for their day. They're, like identifying with them more than I identified as a patient.
Yes.
Um, and then just, you know, knowing everything that was going to happen to me, and knowing that I was going to wake up on a ventilator, knowing that I was going to have these drugs, asking, are you going to use propofol? Am I going to be on fentanyl? What's this going to be? Like, I had one of my friends come. who was a nurse to actually, so that she would be able to tell me the next day, like, hey, can you just, eyeball everything and tell me how I am? And translate things for my parents. Um, but yeah, once I went under, I was under for over 24 hours. So I lost that whole day.
Wow. Wow.
Yeah, it was a big surgery.
Uh-huh.
They took half my tongue, roughly, about like maybe 45%, replaced it with part of my forearm. They take the artery, the muscle, everything, the nerve, and create a flap. And they also did a neck dissection and then the tracheostomy. So, and I had a complication, of course, because I'm a nurse. So um, the venous coupler lost signal while I was in the PACU after surgery, and they had to rush me back to reopen it and fix it. One of my veins had kinked. It was an easy fix, but
Well, thankfully they had that monitoring going on, so they knew that there was a problem, because it used to be that that's not what happened.
yeah,
And so a lot of times the problem would be identified too late.
yep.
Wow, what a story. So how long did you have the tracheostomy for?
We had it. I think it was only 6 days that I had a trach. I was in the hospital for a week, and the day before is when they took it out, and I was able to allow it to start closing. It plugged one time while I was there. Um, I had repeatedly said that something didn't feel right, but I kept listening to my lungs, and I was like, no, it's not my lungs, it's something up here. And lo and behold, found out after I had a rapid response because I couldn't breathe that the tracheostomy, for whatever reason, the tube was rubbing against my trachea and causing scabs to form on the end of the tube.
Mm-hmm.
So it effectively cut off my airway.
Right, it
Uh,
like made a flap and came up.
yep. So
Oh
they,
gosh.
even though I'm like a tiny person, they wound up having to put an XLT in, which was just wild to me. But
Yeah. Thank you for tuning into the Everything Cancer podcast. We appreciate you being here with us. If you are finding this episode useful, please share it with others that you think would benefit. And don't forget to rate us with your favorite podcast platform. Please check out the show notes for more information and more information about our guests, links to their websites, and any other resources they've shared. We aim to make it easy for you to connect and learn more about the valuable insights shared in each episode. We welcome support through sponsors, the Everything Cancer website, and our Patreon page. Please stay tuned for a brief word from our sponsors, and then we'll be right back to our episode. Thank you so much. Do you have a dry mouth that distracts you with that nasty feeling and taste? H2 Ocean has your solution, literally and figuratively, with its sea salt healing rinse. It's made from salt from the Red Sea, and it has other minerals that are beneficial to you in it. It also has lysozyme enzyme, which is soothing to the inside of your mouth, and xylitol, which makes your mouth water. It's very mild in flavor, yet refreshing. Does not make you suck in your cheeks like often happens with other mouthwashes. And it stays with you. Other mouthwashes, they're gone in 10 or 15 minutes. This has stayed with me for a few hours now, and it's great. I plan on using it before every podcast episode to keep my mouth moist without taking distracting sips of tea and so on while I'm talking. The links to the H2 Ocean sea salt healing rinse will be in the show notes, and then a QR code also on the YouTube version of this podcast. It's excellent to help rinsing with chemo mouth or irritation in your mouth from radiation, but mouth sores and just general everyday use. I find it really pleasant and really helpful to use. I hope you do too. Thanks. Wow. And so here you are saying something doesn't feel right. Something doesn't feel right. And people are like, oh, your lungs sound fine. You were fine. And I'm really sorry you went through that. That had to be very terrifying to have not be able to breathe.
yeah, oh yeah,
Yeah.
yeah,
And I think that goes back to us as healthcare givers when our patients are telling us something, there's a lot of value to listening.
Yeah. I learned a lot being on the other side of the bed,
Mm-hmm.
just I had when I left, I wound up having like a stage 1 to 2 sacral um ulcer from
Wow.
mostly from laying on the OR table for so long, but
Yeah.
I think people assume because I was young that I would be moving myself, but I also had a wound vac on one arm, an art line on one arm, a trach, like I wasn't really
Right.
moving.
Right.
And, it just you get a whole new perspective for the patient journey when
Mm-hmm.
you are the patient.
Mm-hmm.
It definitely gave me a whole new lens of empathy.
Right. So, Stephanie, you brought up a really good point that I'm hearing frequently talking with young adult survivors. You said people thought because I was young, I would be moving myself. And in other words, an assumption was made because of your age. Can you go into that a little bit for us?
Yeah, I think, and I know I've been guilty of this as a nurse many times. You see somebody who looks fit or well, I mean, I'm sure I didn't look fit and well at that time, but you see somebody who's young, especially they knew I was a nurse, they knew that I knew what I was supposed to be doing. Um, they, I guess, prioritize differently, hoping that they were correct instead of just taking 5 seconds to ask a question. Are you moving? Or do you need help? Or something else that would put that assumption to rest, right?
Right.
I think that's probably the the biggest thing that would be helpful because it's even as a nurse, I didn't realize that I should be advocating for myself in that moment of, hey, plus I think I was also afraid of being labeled that patient. Um, so, just saying, hey, Miss Gayhart, are you okay? Are you able to move? Have you been moving? What's your, just ask me. And then if I lie, then it's on me. But
Right.
otherwise, that's so helpful. Um,
Mm-hmm.
to just not make those assumptions based on what we think
Mm-hmm.
should be the case. It's so easy to just ask a question.
So, what you're saying is, for our listeners, is that no matter what your background is and no matter what your age is, your caregivers in those situations where you definitively need care or possibly need care, they should ask you and not make assumptions because you had a lot of things happen that didn't need to happen. And nobody, like you said, nobody intended for it to happen. They just thought that you would understand and be taking care of it yourself. But that's a very different situation to be in, nurse or not, to be in the ICU with an art line in, a wound vac, a tracheostomy. I don't think I'd be able to move myself. And plus, with wound vacs, I'd be terrified to move my arm and potentially dislodging the wound vac. Plus, the same thing with an arterial line. And I can't imagine that's very comfortable either to use it as leverage to move your body. And we all know there's a lot of, as nurses, there's a lot of issues with being in bed, being on the sheets, not being repositioned. And so if you weren't using your arms to leverage yourself, you weren't repositioning the way that, or being repositioned the way that it's needed in these situations. I'm sorry that happened to you, but I'm glad you're sharing this to help increase awareness.
Absolutely. It's so important. And, I think as a nurse before all of this, it would have, not that it wouldn't have crossed my mind, but it's much more obvious now that I've
Hmm.
been like, oh, yep, no, can't do a whole lot without my arms,
Right,
especially in those
right.
beds.
Right. I mean, you're kind of like a little T Rex in a way.
Yeah.
You really
And
couldn't use your arms.
even when the
Um,
art line was out, it's like there was that my IV is like, it's always right in the wrist where you can't bend
yeah,
it. And it's, oh, yeah.
or little arms and so on. So take us from the ICU to everything kind of setting in as after your surgery and the healing process.
Ooh, you know?
And if you can't, that's okay.
No, well, so it's funny. Well, it's not funny, but when when I woke up, so I remember hearing, I'm assuming it was a respiratory therapist saying, slow down, slow your breathing. They must have been putting me on a trial to get me off the vent. And I remember feeling it, pushing air in and fighting it, and them telling me not to, but I was so out of it. I was like, what? And then a little while later, waking up and looking around and noticing that I was in a PACU. I was not in my room, which was where I thought I would be. And there was nobody with me. And, I remembered that I was going to have a trach, so I couldn't talk. My tongue was massive, or what was left of it. And I had a bite block in so I wouldn't chew on it. And my left arm, like I said, had this massive wound vac thing on
Mhm.
it. My right arm had the outline and the IVs, and it was tethered to the bed because I was vented, and I had a trach. So, being a critical care nurse, I knew that this was not uncommon. But when I woke up and there was nobody there, and I didn't know where I was, I didn't know what time it was, I didn't know what had happened, you know, I panicked because I didn't have a call bell. I didn't have a way to get to a call bell. And I was like, oh my God, what if something happens? What if my trach plugged? What if I can't, like all of these things start running through my head.
Right, right.
And I started crying. And then I realized that made everything so much worse because I can't wipe my nose. I can't breathe. I can't. So I was like, all right. And I think that was the first moment that I realized I had two choices. I could accept what was happening to me in that moment and control my response to it, or I could just freak out and, continue to have anxiety over things that I can't control. And so I chose very purposefully to just try to just breathe, which I was happy to note that breathing through a trach was exactly the same as breathing through my mouth or my nose, and just, calm myself down. Um, After that, the rest of the week was much easier,
Mm-hmm.
to deal with things. Plus I had, my family and people with me almost all the time. I didn't let my mom leave at one point. And I
I don't
think I
blame
must have
you.
known something was going to happen because
Yeah.
that was the night I plugged. And I was, after that I was like, nope, you're not leaving. Um, and things happened so quickly. Um, I just was constantly amazed at my progress, more or less, than worried, I guess. But when I left the hospital, that was a horribly rude awakening. That's when it all
Mm-hmm.
came crashing down.
Mm-hmm.
Um, yeah, I was so happy to leave, and go home. It was my son's first day of first grade, and I was adamant. I remember that morning, like I was so over being that nurse, that patient. I was like, hey, I know because the residents came through this morning and told me that you wrote my discharge papers and all you have to do is sign them. I know they're there. So you need to send me home, like ASAP. I know I need this person to sign off. I know I need this person to sign off. I want them to come in as soon as possible. Wait, like, I haven't seen speech therapy, which is ridiculous because you took half my tongue and you're sending me home. Like, get it done because I'm going home because it's my son's first day of school. And I didn't make it before he went to school or before he got home from school, but I did make it home that day. Um, and was not prepared for how hard life like this would be. Like I remember driving home and we drove past the 7-Eleven and I got really sad because I was like, oh my God, how am I ever going to like just stop for snacks on a road trip? And all these people seeing these kids and I was like, I should be signing like a million forms for his first day of school, not coming home unable to, do much. Um, and I tried to take my very first shower And we realized that I had to keep this arm, completely dry, and had the tray whole still. And I was worried that the water would get in, and I was like, how do I do this? And trying to like wash my hair with one hand and try to figure out, okay, well, how do I wash my right arm with my right hand? And so like trying to like put the washcloth up against the side of the shower, like it was ridiculous. But I was determined, and I not proud of it, but I at one point was so angry. I think the moment I snapped was my mother didn't remember my favorite bra that would be easy to wear, and I couldn't put it on by myself, the one that I had. And I lost it, and I punched the mirror and it shattered. And then I felt even worse. And I was like, oh my God, like this is the lowest of the low that I could ever possibly feel. And I sobbed, and we all hugged it out, and we realized, you know what? This is huge. This is a lot, but we're going to work together and we're going to get through it.
Mm-hmm.
And I went and saw my son. Um, he was at his dad's house, and he was terrified of me because I was all swollen and weird. And I told him, kind of like Frankenstein. They took one part of me and made a different part of me, and it's cool. I'm like a monster. And then he thought it was cool. Um, it,
From the eyes of little boys, right?
right? At that
You
point, he
did
was
you
like,
did
oh,
great with that one. That was a great adaptive behavior.
you got to think on your feet with these kids.
Yeah.
Um, but yeah, that was the lowest point for me. You know, I already knew how to do the tube feeding and feed myself and all that kind of stuff. I refused, of course, home care because I was like, nope, I got this. Um, did my own dressing changes, did all of that. Sleeping was terrible because at that time I was drooling constantly, and that would come down and into my trach stoma. So I would, it was, yeah, the first couple days were terrible, but you heal and you move forward.
Would you refuse home care now, looking back?
Probably, probably. I am nothing if not stubborn. I don't like asking for help. I don't like admitting that I need help. Um, and something like, dressing changes and tube feeding, I was like, I totally got this. I do not need to pay somebody to come do this. I stayed with my parents for at least the first week. I didn't stay
Uh-huh.
alone, so
Hmm.
I had people there.
Well, that's good. That's good. That determination probably got you really far in a lot of ways, and it probably got you a little bit in trouble in some ways too. But so looking back at that time, what what would you say to other people that are going through, there's head and neck surgical oncology, but also anything major surgical oncology? What, looking back, what would you like to say to other people either facing this or in the midst of this?
Don't be stubborn. Don't be like me. Um, Try to take those moments when you can to just breathe.
Mm-hmm.
Just a second, just 1 second of a pause to understand that you are having an emotion and emotions do not last. Um, can be the difference between, terrible behavior, but a more negative path,
Mm-hmm.
or cultivating a better attitude of resilience and hope and positivity towards what's happening.
Mm-hmm. So kind of when things feel really bleak or you're very angry, count to 10
Yeah,
and get through that moment and then move on and don't react to that. I think that's great advice for someone who's lived this. Really
yeah,
great
because
advice.
there's going to be a lot of moments where you're unbelievably frustrated.
Mm-hmm.
And, that's valid. That's completely valid to be frustrated and angry and
Mm-hmm.
sad and all of those things. But at the end of the day, how you respond to that is going to make a massive difference in how well you do moving forward.
Mm-hmm.
So you owe that gift to your future self. I do that a lot with myself, even in daily tasks. Like, okay, I don't want to wash the dishes, but future me will be so happy that I washed the dishes today. And then future me will sometimes look back and say, "Thank you, past me." Like, it sounds ridiculous, but it really it's like you're giving a gift to yourself.
I don't think it's ridiculous. I think it's a great way to cope with the enormity of the task in front of you, and you were breaking it down into small steps, which is huge. As opposed to looking at the mountain, you were looking at each step that you
Yeah.
need to take, and you were giving yourself energy to take that next step.
Yeah.
Yeah, I think it because I think otherwise it's easy to also just say I can't do this, and you have a son to go on for too and to thrive for, but you were facing an enormous task with everything you had to deal with.
Right.
um and it sounds like you were caught by surprise by a lot of this too.
Yeah, I was.
Yeah. Yeah.
It was a lot harder than I thought it was going to be.
Hmm. um so I think a lot of what you just said right here is really valuable to people listening that are either facing a major surgery after their diagnosis, or they're sitting here nodding their heads and saying, "Yeah, yeah." Okay, so you're at home, you're getting better. Did you ever finally work with speech therapy? Because you're talking beautifully.
Yes. Um, I had a speech therapist that was actually at my ENT's office,
Hmm.
and I met with them pretty often um, for a couple weeks until they finally took the feeding tube out. At that time, that was my biggest motivator was to get this thing out of my nose.
Hmm.
Um, and then slowly, worked on my speech patterns and stretching. And at first, I couldn't stick my tongue out at all.
Hmm.
And now I'm able to do a lot more with it.
Hmm.
Went back to speech therapy actually this past summer because I started to have some issues with swallowing. Um, and they taught me some more exercises to do. And I try to keep up with them. I'm not fantastic with remembering, but when I do it, and it really does make a difference.
Hmm. So you said something that struck me based on our prior conversations and while you were re, um, recalling what that time was like. You talked about approach things with positivity. Um, But you had also mentioned that you feel like for the young adult, sometimes there's not acceptance of reality and instead too much positivity. Can you kind of share? Because I think a lot of other people feel the same way, just from the conversations I've had. So maybe share your thoughts on that, and then also what you feel would be useful. So, not just pose the problem, but pose the solution, what you think might be helpful for that to change the perspective on that.
Yeah, um, there's it's such a loaded issue when, especially when you bring in like social media and stuff. There's so much about toxic positivity and
Mm-hmm.
hearing about this. And I know when I first was healing, you know, I think it's okay to lean on some of the sarcasm and the, you know, more dark humor kind of things. And it's fine until you get to a point where you believe it. Um,
Mm-hmm.
and then it becomes actually negative. And at the end of the day, that's a defense mechanism, right? We build up this wall because we're afraid to experience joy because most of us are truly waiting for the other shoe to drop. We're afraid that something else is going to go wrong.
Mm-hmm.
Um, on the flip side of that, a lot of times there's the annoyingly saccharine sweet, every day is a gift, everything's beautiful, everything's lovely. And while I agree that every day is indeed a gift and things are great, when you say it in such a way, it makes it seem like you're dismissing the other parts. Um,
The struggles.
exactly.
Yeah.
And so for me, I try to walk like a middle path.
Mm-hmm.
Um, and it all comes down to acceptance of the duality of life. Um, life is tragically beautiful. We have the lows and we have the highs, and accepting those things together is what really gives us that resilience and that ability to say, you know what, yeah, this does suck. This is absolutely horrible, and I hate it, and I do not wish this on my worst enemy. But also, I am so grateful that I had really amazing surgeons, and I am so grateful that I am able to watch the sunrise right now that is so beautiful. And, even if you have to look super, super hard to find those little pieces of joy, they're there.
Mm-hmm.
And that doesn't mean that you're ignoring the negative. You can have both. We have the capacity as humans to feel multiple things at one time.
Mm-hmm. I think it's great that you're acknowledging that and acknowledging that you have dark moments, you have moments where you feel overwhelmed, and in the same moment or the very next moment, you can experience joy. But I think there's a need to respect the struggle, respect the dark moments, and acknowledge them. Um, because I think otherwise people feel like the impression I'm getting from conversations is that we're not free to talk about it. It's kind of pushed under the rug, the dark piece. And instead, I think the resilience should be um, acknowledged, the strength, the struggle, and wow, someone else I saw post, instead of saying you've got this, say this must be really tough,
Yes, yes. And
because you for moments don't feel like you have it, and you get back there at some point, but it's you're doing a step of future me. Let's get back there. And I didn't mean to interrupt you, but go ahead. I'm sorry.
no, no, I was just agreeing with you. And it's that whole piece of compassion and empathy versus sympathy. And
Mm-hmm.
when you empathize and when you're compassionate with somebody, compassion literally means sit with passion, and you're there with that person, whatever they're going through. You sit with them. You don't try to make it better. You don't try to fix it. And I think we have a really difficult time in medicine and just in our culture in general of always wanting to make things better. We just want to make it better, make it better, make it better. And when we do that, we ignore the fact that number one, we can't make it better. Um,
Mm-hmm.
everybody has their own journey. But number two, sometimes we need to sit through, or I would argue all the time, we need to experience those negative feelings. We need to experience those things because they're still a very valid part of our journey. And if we don't, we might not move past them, or
Right.
and so it's it's a shame that we don't do that more, and we don't take that time to just really sit with people.
Mm-hmm. I really like that. Sit with people. So our listeners hear that. Sit with them. Be compassionate.
Right.
Be.
Let them experience what they're experiencing and just
Mm-hmm.
accept it. Just
Mm-hmm.
accept that, yes, this sucks and I can't fix it, and accept that that sucks for you too. Like as a caregiver, that hurts. It
Right.
hurts as a mom when my son is hurt and I can't fix it. But,
Right.
we
Right.
just have to accept it and be there with them.
So, what helped you get through those dark times? What helped you get through those moments where you felt dark or overwhelmed?
I think for me, number one, I got really into um, Buddhist philosophy. I read the Book
Mm-hmm.
of Happiness, the Art of Happiness, the Book of Joy, and then I became obsessed with Pema Chodron and all of her work. And I really liked that she also uses like this humor with her, telling of how things are, and this almost radical acceptance of, yeah, as humans, we kind of suck sometimes, and it's hard, and we'll never be perfect, but we can accept that. And then we notice it. And then the next time we're like, oh, there I go again. And it just becomes a practice of, oh, I'm going down that negative path. Let me think about that. Why am I going there? What am I doing?
Mm-hmm.
Um, so there was that piece. And then also just a lot of humor, trying to make light of it. And to be honest with you, when I think from day one, when I was diagnosed, I knew that there were two options. There were two paths. I could be the person everybody felt sorry for. Oh my gosh, poor Steph. This must be terrible. Oh my gosh. Oh no. And I could feed into that. Or, wow, Steph's doing really well. I can't believe it. Like she has cancer and she's still out and about and smiling and whatever. And, again, it's that balance, right? You don't want to be this, oh, you're an inspiration all the time, but
Mm-hmm.
you also don't want to be stuck in this despair. And I
Right.
did not want people to think of me as or Steph ever.
Right. 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 Um, and that's different. Thinking of you as poor Steph is different than someone sitting next to you
Yes,
and being compassionate during your dark moments. They're there to lend their support. And while they can't necessarily fix it in that moment, just having that companionship so you're not alone in those moments is
100%.
huge. It is. So so I don't want people to say, but this is oppositional, and it's not. It is, or mutually exclusive. It's not. You're describing two very different things. And another thing, when I just talked with Selma Harfouche about 2 weeks ago, she described much the same way you did, and I said, it's like you're on a road with two lanes side by side, and one lane is the dark lane and the other lane is the feeling good, taking good care of myself, having a good attitude lane. And it's natural to drift into the dark lane. That's part of it. But then what do you do to get back into the lane of having a sense of humor, of tackling your problems, of living life again instead of feeling sorry for yourself? So, and I love how because what you talked about just now was being mindful. So you basically practice mindfulness on steroids.
Yeah.
And I would love it if you would send me a link to that book so I can include it in both books, so I can include that both of them in the show notes. That would be very helpful.
Oh, absolutely.
But yeah, that was incredible. That mindfulness of sliding back into the dark area or the despair area. Okay, that's what's happening. And then also counting to 10 to get past it and pulling yourself back into an area of um, doing something about it.
Yeah.
So I applaud you
Mindfulness
for that.
is probably, I'm a big champion of mindfulness based stress reduction, things like that. Just like I said, even before, just that pause and remembering that
Mm-hmm.
emotions are transient. I am gonna, it's gonna wash through me and it's gonna keep going. And eventually I will feel better again. That's life, right? Like it's just a
Mm-hmm.
roller coaster. Um, but it takes practice. It takes a lot of practice to
Mm-hmm.
be okay with that because I mean, our society is not one that condones pausing very often.
Mm-hmm.
It's usually go,
Or
go,
not
go.
fixing things. That
And
we always
fixing.
want to fix things.
Right. It's okay
And
to just let it be as it is. It's okay as it
yeah,
is.
right. But the company is huge. You're actually fixing something by providing company.
Exactly. Like just being there, just having that,
Mm-hmm.
the seeing that somebody can say, I see you and you're valid as you
Mm-hmm.
are. That's,
Mm-hmm.
that is the best gift that you can give another human being, I think.
I'm really glad to hear you say that. I like that. I see you. That's great. So what what messages, this is a big question, probably a lot of thought, but what would you like other survivors who are feeling what you're describing, what would you like them to know about where you are now and what you feel is most helpful to them?
I think, number one, we all feel alone when we start, especially AYA survivors, none of us think that there's anybody else out there like us. But there is. So you're not alone.
Mm-hmm.
That's a big one. Um, and regardless of the type of cancer or the treatment or what have you, everything that you're experiencing, all the emotions, all of it is valid. Um, you are a human being. You know, I punched a mirror for crying out loud. Um, give yourself grace for feeling those crazy, ragey, why me type of feelings. It's okay to feel that way.
Mm-hmm.
Um, and just recognize that it's temporary, and there will be moments where you can look up and say, okay, you know what? I'm grateful for my dog or
Mm-hmm.
whatever you have around you that, can kind of give you that little feeling of peace again.
Mm-hmm. So I think finding a community, however that happens, of other people that have that shared experience, where you are able to speak in a safe space is really important.
Yes.
Yeah, so that you're not alone. Because I think other people, while they're there providing the company that we just talked about, it's nice not to have to explain what's happening. You can just start talking and somebody else will get it. Where would you like to see survivorship care go?
Ooh.
And you can, I mean, I know that's a loaded question too, but what what strikes you the most?
From from my experience, so I did not get a survivorship care plan, any treatment summary. Um, Even though my surgeon and my radiation oncologist were in the same network, they barely, I don't even think they ever saw each other in person, like ever.
Mm-hmm.
And they didn't agree with each other on my diagnosis. They didn't like it. So having more cohesion, um, even from diagnosis forward, because survivorship doesn't start somewhere down the line. It starts the day
Right,
you're diagnosed.
right.
Um, Seeing that supportive care for every patient start in the beginning and
Mm-hmm.
going along with them so that it changes with them, because you do change. You 100% change. There is
Yes.
absolutely a new normal. Um, you I called it my Phoenix process. I died, I fell into the ashes, and Steph 2.0 rose out of it. And, you know, I would like to see more support in that respect to helping people understand, how do you grieve yourself? How do you, because I had no idea. How do you move forward in life after this massive change? So I guess that would be more psychosocial support,
Mm-hmm.
more just integrative care, things
Mm-hmm.
that are tailored to the population that you're working with. So,
Mm-hmm.
not everybody's going to want to do mindfulness, but the people
Mm-hmm.
that are, it's going to really, really help. And
Mm-hmm.
just having, I think, providers too, having a better understanding of survivorship.
Mm-hmm.
Obviously, acute care cancer providers, oncologists, med-onc, rad-onc, surg-onc, they don't have time or resources to
Mm-hmm.
do survivorship. There's no way. They have to stay on top of a billion changing, like literally constantly changing guidelines.
Mm-hmm.
We want them to focus on that. um,
Right.
I think survivorship is probably going to wind up being a whole different specialty, um,
Mm-hmm.
especially given the amount of AYAs that are coming into the world and the length of survivorship, um, the long-term effects, the follow-ups that we'll need to continue down that road physically, psychosocially, mentally, financially. Um, it's going to take a whole different team of people to kind of work together to move that needle forward.
Right. And we're not faulting providers, like you said. There is a need for the people that are involved with acute oncology to concentrate.
Yep,
And there's also so many things happening so fast in the oncology world, with protocols changing and keeping on top of those and so on, which is good because that's creating more survivors.
exactly.
And our I think it's a matter of us catching up. We have these people that are caught in the middle dealing with all of these issues. And I like how you said Steph 2.0 or 2.0, because that's what I'm hearing over and over is you're a different person.
Hmm.
And maybe to be prepared for that would be helpful.
Yeah,
Would it be terrifying to hear that ahead of time, do you think, or do you think it would help?
I think any honest conversation with compassion and kindness should be had about what the actual future could look like.
Mm-hmm.
And being honest again, that it may not. You may come out of this, you may be one of those people that just whatever, I don't know. You're a unicorn and it didn't affect you, and you're like, cool, go back to work, I'm fine. Um, and
I
that's
think that's
great.
the rare person.
Right. But I think having that conversation, even if it's scary to hear too, like that you might die. It's scary to hear
Uh-huh.
that you have to have half your tongue removed, but
Yes.
it's still necessary information. And telling people what could happen psychosocially, financially, whatever ahead of time so they can maybe plan, even if they don't, at least they know and they know what's coming. I think that's kind of due diligence.
Mm-hmm. So warning someone this can happen, because I think people look so much towards the end of treatment, and the treatment does, for the most part, um, except when someone goes on maintenance. But even so, the acute phase of treatment does end. To acknowledge, and to acknowledge up front and acknowledge then it's okay to mourn who you were. That's how you're going to move on. And to maybe help people to understand that that is something that, as those feelings start going through them, this is a normal process, and it's healthy for you to acknowledge it and talk with people around you about it, and find people who've experienced it, like we talked about, the shared experience, because they're going to support you through that. I really like a lot of what you're saying here. And what else would you like to share about your experience or your vision for the future?
Um, I just, I really, really hope that we can start seeing survivorship, cancer survivorship, as kind of a chronic condition. Um,
Mm-hmm.
Acknowledging that, like so many people say, cancer doesn't end if and when treatment ends. Like it's always going to be part of you. There's always going to be that,
Mm-hmm.
whether it's regardless of how it was treated, there's something with you that stays, um, even if you never have another recurrence. Um, so I think acknowledging that, and again, the whole, you know, treating survivorship as kind of this emerging specialty and catering to it that way, which is difficult because there's so many different treatments and so many different cancers. But I think it would really benefit the healthcare system as a whole, um, to do that. Aside from obviously us cancer
Mm-hmm.
survivors, right?
Mm-hmm.
I could go for days about that part of it too. Excuse me, but
No, that's okay. I like that a lot. I like survivorship as an emerging specialty. How did your way of advocating for yourself change through this experience?
uh, I don't shut up about survivorship. Um, I right after I was super bummed because right after I completed radiation mid-November of 2019, and then obviously the pandemic hit, and everything shut down like right about the time that I was able to eat again. And I was all excited to go out. I was like, I'm gonna have my Relay for Life team, and we're gonna do all this stuff, and the first Cancer Survivor Day, and we're gonna have a party. And all of that got killed. Um, but I joined the National Coalition for Cancer Survivorship Cancer Policy and Advocacy team. And
Wow, I love it.
last year went on my first Hill Day. And the process of being able to talk to people on Capitol Hill about why survivorship is so important and to talk to politicians who are championing survivorship and seeing that it's, we have a long way to go, but there are people out there
Mm-hmm.
fighting for us.
Mm-hmm.
And being part of that fight is so empowering. And once you start, it just becomes more and more of like, oh, I want to do this more. Um, but yeah, I talk about it any chance I get. I share my story. I talk to people. I people reach out to me on social media, and I'm happy to help any way I can. I started a group for other young adult tongue cancer survivors with a friend of mine, and she's in the UK. And you know, it's amazing to see all these things grow just from being able to talk about it and help other people that way.
Thank you so much. So you're not so much you're advocating for yourself, but you're really advocating for everyone right now. That's where you're putting a lot of your energy, it
Yeah,
sounds like.
yeah,
And you're
because
so well spoken. Thank you for doing that.
yeah, I mean, I I'm I'm good. Like I want to see the system change.
Hmm.
It doesn't, not that I don't matter, but that's what that would make me happy.
Hmm. I'm so glad to hear you say that. I mean, you do matter very much, and your
Yeah.
voice matters, and I'm glad it's there because you can articulate things that I think other people would struggle with, and that they would like to have out there. Um, and NCCS is an amazing organization. I'm going to provide a link to that as well in the
Yeah,
show notes.
they are
Um,
fantastic.
but thank you for being part of it and being on the national front with it because you are part of the change,
Yeah.
which is great.
And
Stephanie, go ahead.
I was just gonna say I highly recommend to anybody, any survivor that from any cancer, any age across the US that wants to join that organization and do what they can. I mean, even if you can't make any in-person meetings, they have webinars, and it's just a really empowering feeling to be a part of
Mhm.
that. And it's
I
free.
think it's a great organization. They have so much good information on that website. And if you're not one to be part of the movement, you can learn so much for yourself about it
Yep.
and about self advocacy, practicing good, strong self advocacy, which is really important. Another place I have found that I really like is Cancer Research Institute,
Hmm.
which I wasn't very familiar with until I really started doing a deep dive into resources out there. And it's not one that's spoken about that I'm familiar with a lot, but they have a lot of great information on their website too, and include a lot about self advocacy. But NCCS really set the standard for advocacy in cancer, and and then also on the national front and for survivorship. And they clearly defined survivorship as starting from the time of diagnosis.
Yep. Yeah, they are
Absolutely.
the experts, I think.
Yeah, I would agree. So I'll include a link to that too. You're there on the national front speaking up for everybody listening, um, and everybody that's a survivor listening. Thank you for giving everyone who is a survivor a voice. That means so much. And thank you for everything you've done. Um, you've been on an incredible journey and it's
Thank you.
continuing.
Thank you so much
Yeah.
for letting me have a voice, for giving me a platform to speak. I really appreciate what you're doing for survivors
Oh,
and for
thank you.
survivorship. It's so important to elevate the voices that are out there,
Mhm.
because we all have to be heard. We all deserve to be heard.
That's correct. That is right. I'll just take a quick second to plug my book, which is Cancer Journey Guide and Journals, Empowerment in Diagnosis, Treatment, and Beyond. And it is It's talking about giving yourself a voice in an effective way and becoming an integral part of your own healthcare team so that you can have that voice, feel as good as you can at any point on your journey. A big part of it is journaling in any form. And you said you did it on your phone, correct? Okay.
I had a blog.
Journaling in any form. You had a blog.
I
So you
had a
journaled for
blog.
everybody to read it too.
Yep.
How did that help you?
It was so healing. Writing it out. I've always loved writing. So just that it's cathartic for me. When I was having, especially, I didn't even think about this earlier, but when I was having those difficult emotions, I would write, and I would write poems. I would write, just write about what was happening, write about what I was feeling. And I think doing it in a format that was a blog for me helped, because I knew somebody else would read that and identify with it and understand they weren't alone. And that also helped me heal and not feel alone. And I don't know if it's because I'm a nurse and I just inherently derive, joy from helping other people, but that helped heal me.
Is your blog somewhere where people can still go back and read it?
It is. It is.
Okay.
It is at onelifeonechance.blog. So I can give you that link.
Send me a link to your blog on there, and I'll post it in the show notes, because I think it'll be really helpful for people to understand that they're not alone in this.
Absolutely.
Stephanie, it's been wonderful having you. Thank you so much for being here with us and making a difference for everybody.
Thank you.
Thank you for joining us on this episode of the Everything Cancer podcast. We hope you found the conversation as insightful and as inspiring as we did. Remember, all the details about our guests, including their contact information and links to resources they've shared on their websites, will be included in the show notes. If you've enjoyed this episode, please consider supporting us by visiting our website, checking out our Patreon page, or becoming a sponsor. Your support helps us to continue to bring you these important discussions. Don't forget to subscribe to the Everything Cancer podcast on your favorite platform and follow us on social media. Always remember, the information shared here is not intended as medical advice. For any personal health concerns, please consult with your healthcare team. Thank you so much for listening, and we look forward to having you back with us again next time. And for anybody that you have invited to join us, please reach out if you would like to be a sponsor. We would welcome you. Thank you.